everyone, this is Melissa Sweet, public health journalist from Croaky Blog, and sitting in a cafe here with Sandy Davies, legend in Aboriginal health, long-term advocate for Aboriginal people, and we're going to be talking about just justice, looking at the solutions to the over-incarceration of Aboriginal and Torres Strait Islander people. So Sandy, could you just start by introducing yourself, telling us a bit about where we are, who you are, what your background is?
Yeah, thank you, Melissa. Well, obviously we're in Geraldton in WA, where I'm the chairperson of the Geraldton Regional Aboriginal Medical Service. And also I'm the deputy chair of the NACHO, which is the National Community Controlled Health Organisation, in terms of supporting 158 community controlled health services around Australia. My background is that I've been involved in Aboriginal politics most of my adult life. As a child I grew up on stations, living in the mustering camps with my Aboriginal families, and there was so much poverty back then, and people, the old saying, they were working for threepence a week and a tin of jam. Since I've grown up, I've always made sure that none of our children would have to go back to doing that. But one of the real major issues that I have is about domestic violence and child abuse. Federal government has said that they're going to address this issue, and in Canberra they've allocated some money, they're setting up guidelines, they're setting up policies, they're setting up legislation, when none of them really know how to address domestic violence and child abuse. What the federal government needs to be doing is making sure that there is adequate resources going out to service providers, out into the communities, remote communities, rural communities, wherever there are service providers who are providing a service to people who are suffering from domestic violence and child abuse, and allowing them to set their policies and guidelines on how to deal with the issue in their respective states, respective communities, respective towns. Because they are the experts, because they engage with people who are suffering these vicious crimes every day. Where in Canberra and in governments are making legislation when they know really nothing about what domestic violence is all about. So we need to make sure the resources are out there. The other thing I would like to ask the Prime Minister, and I understand there's 69, I think it is, we're up to 69 women this year around Australia who've died or been murdered as a result of domestic violence. I want to ask the Prime Minister, how many women have to be murdered or die as a result of domestic violence a month before he sees it as a crisis? In terms of our children, we need to be addressing the abuse and neglect of our children. Kevin Rudd said sorry to the stolen generation, but since Kevin Rudd apologised, the removal of Aboriginal children from their families in Australia has increased by 67%. I'd like to know who intends to apologise to those people in 20 years' time when they grow up. So while the apology was great, and it certainly eased the pain of a lot of our old people, and the fact that Kevin Rudd had the courage to do it, we haven't really solved the problem. And the problem is we are still having children removed from their families, and we need to ensure that that doesn't continue to happen. We need to reduce that. With domestic violence, my view's always been the same. If anyone commits a violent act against another human being, then there needs to be a prison sentence. They need to be in prison, because the simple thing is that if they commit one act of violence, they may have been doing act of violence and domestic violence for 10 years. And it's probably, it takes them 10 years and then they finally kill their partner. So we need to be, that is the core of what I'm working on at the moment in Western Australia with our health service.
Sandy, just to let you know, Summer May Finlay just chimed in to say hello, and we've also had people saying hello from Canada and from the Ukraine. So there you go, people listening all around the world. Now,
I love you too, Summer.
Hope you're listening, Summer, still. So you've talked about the need for, jail and serious punishment for violent offenders, but we know that many Aboriginal and Torres Strait Islander people going to jail are not going to jail for violent crimes. They're going for unpaid fines or driving offences. Do you think there's room there to do things differently so fewer people end up in the system?
Absolutely. I use an example in Geraldton. We have what is called the Bundy Mulga courts, and that Bundy Mulga courts is a representatives from the Aboriginal community with the magistrate who sits in a court with them and addresses domestic violence. Now, our prison in Geraldton, like the rest of the state, is overcrowded with Aboriginal people serving out failure to pay fines, minor drug offences, drunk driving offences, many minor crimes that we could look at an alternative from. But in Geraldton, if a man assaults his wife, he gets an alternative. He gets to go to the Bundy Mulga court, where he gets an option to go through a number of courses, right? And then if he follows those courses and in 12 months, then he doesn't get imprisoned. To me, that is the wrong way around. Anybody who commits acts of violence against any human being, and in particular women and children, need to be in prison. And the people who are in prison for these minor drug, alcohol, driving offences need to have alternatives. But for some reason or other, the government has refused to allow us to put these programs into place. So it seems to me the government continues to get things back to front, and I will never support any program that has given alternatives to people who commit acts of violence against women and children. So that's certainly my stand, and we'll continue to fight that in Geraldton and across this state, and as the National Deputy Chair across the nation if I have to.
Now, Sandy, you were instrumental in organising a prison health conference here in Geraldton. So can you give us an update about what the issues are for prisoners themselves in terms of their health? Is enough being done for the sake of prisoners?
No, there's not. And the other thing is, there are so many people in prison who shouldn't be there because of their social, emotional and mental health state. If somebody goes out and does some crazy thing and is arrested and charged and goes to court, they've got their lawyers there and the magistrate, but nobody who's got expertise, such as psychologists or psychiatrists, who can talk about mental health. So what the magistrate does is jail people. Right? So there are so many people in prison who have mental health issues. One of the things we've talked about is that we should have people, someone qualified, to basically engage with some people who are going to court and address their mental health status. But we don't have that. That's not an option for the person who's in court. So our jails are full of so many people with mental health issues, so if they go in when they've got mental health issues, when they come out, they're just really gone. So that's something we need to be addressing as well. And strangely, we had the Prison Health Summit, and 4 weeks or so, whatever it was, when the budget came down, the state government removed the prison health funding. So we had to withdraw we lost our funding, but we haven't stopped our prison health program. Our two prison health social workers, health workers and social workers still visit the prisons, and we picked up any shortfalls that we've had. But not every service will be in a position to be able to do that. So I think that's why we need to, it seems to me government's doing things all the wrong way around, and they're obviously engaging with the wrong people. Yeah.
So I did hear when I was up north that the Aboriginal prisoner visitors scheme in Roban, for example, had been stopped.
Yes.
In other places. So.
The prison health and visitors scheme in Roban was probably one of the most successful in the state. And the lady who was running it, Elaine Maria, I think in the previous 12 months had something in the excess of 300 clients and it was one of the few things that was really successful and working well out of the prison. And Elaine was working for for Murrunkara, Aboriginal Health Services.
Right. Yeah.
So the Aboriginal Medical Service was very much involved. But of course when the prison health money was taken, that program was also shut down. So it's just, to me, it's just totally crazy on what this state government's doing.
What was the rationale for stopping the prison health funding?
Well, this prison health funding was a statewide funding, and every region got funded to set up a prison health programs. Now, Roban in the Pilbara, Graham's in Gascoyne Murchison, and Albany were the only three that managed to get it up and established. And for whatever reason, other regions weren't able to get theirs off the ground. Now, what the state government should have done was had a look at the issues within those regions where there weren't any prison health programs to see if they could address what the issues were. And if they wanted to remove funding, take the funding away from those regions where it wasn't working. But no, because it wasn't working in some regions, they shut the whole program across the state. So the three regions where it was working extremely well are now back to square one, where we now have no funding. And if we want to run our prison health programs, we're going to have to do it within the budget that we have.
And what is the actual impact of that happening? What's the impact on prisoners' health, on
it's a massive impact, because in our region, when if a prisoner is under our doctor, because our doctors service the prison, if a prisoner is under our doctor's care, when him or her come out of prison, we take them back to their remote community. And our prison health workers will visit them either weekly, fortnightly, monthly or quarterly, all depends on the seriousness of their health, until they get the all clear from the doctor. And then, so they actually get follow-ups, so that when they come out of prison, we don't forget about them. We continue to follow them up in their communities until the doctor gives them the all clear. It's a great program, because what happens now is we treat people in prison for all sorts of illnesses, and when they come out, they go back to their communities. They then themselves have to try and organise how they're going to address their health issues, and some of them live 400, 500, 600 k's from the nearest town or health service. In our region, we are continuing to provide that service, but as I said, there are regions where they might not have the capacity to be able to do that. And it's a very important program. And there was a report done in Queensland some years ago, and if you have a look at the number of prisoners who come out of prison who are hospitalised within the first 12 months have been out of prison, it's a very scary document to read. So there are so many health issues around Aboriginal health, but I want to reiterate the fact that domestic violence and child abuse in this country, across the board, while we focus on Aboriginal people, but across the board, must be stopped. And the only way we can stop it is make sure that we provide the most severe penalties that we're able to provide to put people in prison. I mean, it may not stop at all, but if people know that if you bash your wife, that you're going to go to prison for 5 years on your first time you front up, people will be very reluctant. And for you men out there who are listening today, if you get to the stage in a debate or a dispute with your wife, and you get to the stage where you feel you need to hit them, my advice is pick up your coat, go out the front door and go for a walk. And then come back an hour later when things are settled. Don't take action. I do not support, and I'm absolutely appalled when I hear about men assaulting women and children. And it's the men of this country, it's not the women of this country. They've been making stands for years. It's the men of this country who need to stand up and put a stop to this domestic violence.
Summer's just sent a question. She'd like to know what early interventions for young men would help to prevent domestic violence. So about prevention.
Well, the prevention for it is, well, the fact is it needs to start in the schools. Now, and not at the high schools. One of the things that at high school, by the time young Aboriginal men and women, but in particular Aboriginal men, get to high school and they're 14, 15 or 16, they're very angry. And they're angry because they're lost. They don't know who they are, they don't know where they come from. And in West Australia now, in some parts of Western Australia, in the schools, they are now teaching Aboriginal language to grade 1s, 2s and 3s. An example is, I'll use it in my own family as an example, while we don't come from that country. My daughter and son-in-law live in Karratha. They've got an 8-year-old granddaughter who goes to school up there, and every Thursday morning they are taught the language of that country.
Is that by Linda Ryder by any chance? I met Linda Ryder when I was in Karratha.
More than likely, and probably her husband.
Yep, Bernie. Yep.
Yep. Now, my granddaughter, while she doesn't come from that country, she can actually sing all her nursery rhymes in language. She can count in language. She can name every animal in language. And I have her on video, and it just makes you feel so proud. And when they're singing and talking, you can see the glow in their face. And so one of the things we need to ensure that by the time our kids get to 15, that they do know about their music, that they do know about their culture. There's no point in starting at 15 or 16, because by the time they get to high school, they're angry. And one of the experiences I have on occasions, I go to high schools to talk to classes about different Aboriginal history and other things. And there'll be Aboriginal boys and girls in the room. When I'm finished and we have questions, very seldom will an Aboriginal child ask a question. Reason for that is because they're embarrassed to ask a question, because they think that all the white kids in the room have the expectation, because they're Aboriginal, that they know it already. And the fact is that they don't. So we need to be engaging with our children at a much younger age about their Aboriginality and culture and their family backgrounds. So by the time they get to teenage years, they know who they are, they know where they belong, they know where they come from. And I think you'll find that then, as they go into teenage years, their life will be better. The other thing we have to do in terms of prevention is a lot of the kids get up in the morning and they go to school. When they come home from school at 3:30, if mum and dad aren't sitting in the lounge room consuming alcohol, they're sitting in the wash house smoking a bong. Now, that gives a sense of no hope to our children. So while we do need to be looking at alternatives for children, education and working with our children, we also must have support programs in place for parents. Because it doesn't matter what you do with the children. At the end of the day, when you can take them to workshops, you can take them anywhere you want through the day, but at the end of the day, they've got to go back to the same environment, whether my parents are drunks or their parents are on drugs. So it's a band-aid solution that we have. We need to make families and parents accountable for their children.
And you mentioned earlier some work you were doing, I think at Graham's, where when the young mothers come in and while they're in the waiting room, that you're actually using that as an intervention opportunity. Would you like to describe that?
Yes, well, in Geraldton and probably a lot of other places around Australia, we have so many children having children. And the young girls who come to the child and maternal health days, it is scary to have a look at the number of girls who range from 14 up to 17. And some of them have had more than one child, and they've come there because they're having a baby. And they sit there and wait for their turn to go in, but nobody actually sits and talks with them. We've set up an oldies group, and what is happening is we have a number of senior Aboriginal women and men, and we provide tea and coffee and sandwiches and biscuits, and the old ladies sit there and talk to the girls. while they're waiting to go in. It's just an exchange, it's a conversation, and the girls open up to the old ladies, and the old ladies give them that sense of security and advice, and it's working very well. That is a really big issue, is the number of our young girls who are getting pregnant and having children at very, very young ages. So we put that elders program into place there, and it works exceptionally well.
That might be a great idea for other places if they're not already doing it. Now, Sandy, just before we finish up, is there any final message that you'd like to give Prime Minister?
I do, and I'm very clear about this. I wrote to the Prime Minister, Turnbull, and explained to him that he needs to, when engaging with Aboriginal leaders, he needs to expand his horizons. With no disrespect to the Noel Pearsons and the Warren Mundines of the world, there are many, many strong leaders around this country who the Prime Minister needs to be engaging with. Now, there are many remote communities in Western Australia with large numbers, 300-400 people living in them, who survive and strive in the desert communities with limited amount of resources given them by government, because they have strong leaders living in their remote communities. The government needs to be getting out and engaging with the leaders of these communities, instead of taking advice from people who have been around for years, who very seldom engage in the desert country. And I do not want to insult people, but not all Aboriginal leaders come in suits. There are many, many strong men and women in our rural and remote communities who are extremely good leaders, and that's why our communities survive.
Terrific. Well, thank you very much, Sandy Davies. It's been wonderful sitting here in Geraldton talking to you for the Just Justice Project. Did you want to say one more thing before we go? Yep.
Hello, Summer.
I
just wanted to say that I had tea with Summer.
Yes.
In Canberra last time I was there, to talk about the exact thing, and maybe Prime Minister Turnbull would like to be engaging people like Summer. Her ideas and her views about domestic violence and child abuse was music to my ears. We had a wonderful meal, and she is a very nice lady, so I'll see you over there shortly. Summer.
She just said hi and thank you. Thanks, Summer, for joining. Goodbye now, everyone.